So let's get you some answers about the coronavirus from a local expert. As usual, here we are joined by the gracious Dr. Erika Hamilton, a microbiologist from UMass Amherst. Hello, Dr. Hamilton. Thank you for coming on today.
Hello. Thank you for having me.
We are very happy to have you, and we have a lot of questions that require your expertise here. So the first one goes like this. The state says there's been a 64% drop in the rate of positive tests over the past month. What do you think could lead to a positive test rate rebound?
We will get a rebound of positive test cases and more illnesses if people don't follow the recommendations that are being rolled out as the state reopens. So we are beginning to reopen things. People are going to be able to start to do more things like get a haircut, go see their dentist. But there will be restrictions about all of those, whether it's wearing a mask, maintaining social distancing, things like that. If people don't follow those recommendations well, then we're going to start to see an uptick in cases. And in fact, this is happening in some other states that opened up earlier than we did, such as Texas and Georgia.
The onus really is on us to get through this thing, and we don't want to screw it up. So following some of that sound advice is key here. So the next question, you'd mentioned it, dentist's office, things like that. So while doctor's visits are likely a part of phase 2, do you think people at home should maybe consider postponing a visit to the dentist's office or another sort of doctor's office visit? What do you think there? I'd guess no.
Well, that kind of depends on you and how you're feeling and a conversation that you would have with your doctor or your dentist. The danger in continually postponing well-visit appointments is that, especially if you've had some symptom or something's been going on that you didn't know what it was and you're a little suspicious about it, you may want to maintain your appointment and go in and see your doctor or your dentist and have a conversation about it. If you're feeling perfectly fine, and you feel like there's nothing that you really need to talk to your physician or your dentist about, you could certainly delay these appointments a little bit longer if you want. But if something's been going on, it would probably be a good idea to get into your doctor or dentist and have a talk with them.
Yeah, at the very least, maybe do a telehealth or something like that. Okay, so the final question goes, as more people get tested for the virus, can you test negative and then later test positive for COVID-19?
There have been some rare instances of this happening where someone has been sick and they've been tested for COVID-19 and the test came back negative. And then a short time later, they're retested and they're positive. When this happens, the most likely explanation is that something went wrong with the test. Now, the molecular test to determine whether or not you have a current COVID infection is a very, very fussy test to do. You have to have a lot of things that work exactly right for it to work properly. And one of the biggest things why the test goes wrong is the sampling process. So when the swab is put into the back of your throat or into your nose, sometimes just by chance the swab misses the area where COVID is. It may not have picked up enough viral particles for the test to work correctly. And even things like the type of material that the soft part of the swab is made out of can actually have an influence on the test. So usually when there is a false negative reaction in the test like this, it is due to something going wrong with the sampling or enough virus particles were not picked up in the first place, and so the test couldn't detect it.
Very interesting there, and deep, that answer right there. You hope those false positive tests and false negatives can be fixed rather soon. Dr. Erika Hamilton, thank you for coming on here on this Tuesday afternoon. We really do appreciate your insight here, and we'll continue to hear from you throughout this ongoing pandemic, folks. At home, please tune in right here at 12:30 to ABC 40 as we'll continue to get experts just like Dr. Erika Hamilton, who I hope has a fantastic day, and we'll get you through this pandemic. We'll all get through